Welcome to this training session designed to help you help your clients obtain and maintain good oral health. Here is what we'll review in today's session. Dental terminology, the benefits of good oral health, why good oral health matters, and what you can do to support the oral health of pregnant women, infants, toddlers, and children. Connecticut Dental Partnership, our mission and services, who, when, and how to work with the Connecticut Dental Partnership. Today's goals are identify and suggest good oral health habits for pregnant women, moms, infants, and children. Understand the mission and services of the Connecticut Dental Health Partnership, the Dental Plan for Husky Health. Refer a WIC participant who is a Husky Health member to the Connecticut Dental Health Partnership, call center, and care coordination teams. Now, let's talk about dental terminology and oral health conditions. Tooth decay or caries, more commonly known as cavities, is the process of damage to the tooth surface over time, which can eventually result in a cavity or hole in the tooth. Early stage of tooth decay, white lines at the gums are first stages of tooth decay. Notice the top tooth on the right, tiny holes. Severe tooth decay, significant tooth decay and cavities, these teeth will likely need to be extracted. Gum disease or periodontal disease is an infection of the tissues that hold the teeth in place. It is typically caused by poor brushing and flossing habits. That allows the plaque, a sticky film of bacteria, to build up on the teeth and harden. Gingivitis is a mild early form of gum disease when bacteria infects the gums, often making them swallow, red, or quick to bleed. Periodontitis is an advanced stage, can lead to sore bleeding gums, painful chewing problems, and even tooth loss. Sugar that we eat in combination with natural bacteria that exist in our mouth makes acid. Acid can damage the tooth surface, causing holes in our teeth over time. So tooth decay is preventable with good diet and home dental care routine. Now let's talk about good oral health for pregnant women. Why good oral health matters for pregnant women? Untreated gum disease in pregnant women can harm their systemic health. It is linked to poor pregnancy outcomes, including low birth weight and premature birth. Research suggests that some prenatal oral health conditions may have adverse consequences for the child. Elevated levels of this inflammation have been found in the amniotic fluid of women with periodontitis and preterm birth, compared with healthy pregnant women without periodontitis. Now, our second point, pregnant women are more prone to gum disease, periodontitis, and cavities. In fact, 1 of 4 women of reproductive age have dental caries. Due to morning sickness, the mouth is exposed to more gastric acid that destroys the dental enamel. Pregnant women are at higher risk of tooth decay for several reasons, including increased acidity in the mouth, sugary cravings, and limited attention to oral health. And finally, teeth can loosen during pregnancy due to increased levels of hormone affecting the ligaments and bone that supports the teeth. Here are some tips to keep your mouth healthy. Every woman needs to get a dental exam. Appointments should be made before delivery. And by the way, red or bleeding gums are not normal. Let's review some commonly asked questions. Is it safe to have a dental visit during the pregnancy? The answer is yes. In fact, it is highly recommended. At what point in my pregnancy should I have a dental exam? Get a dental checkup before your delivery. If your last visit was more than 6 months ago or you have oral health issues, schedule an appointment as soon as possible. What about dental treatments? Are they safe while pregnant? The answer is yes. X-rays, local anesthetics, and most pain medication are safe as long as your dentist is aware of your pregnancy. So when you're talking to your clients, ask, when was the last time they went to the dentist? Some pregnant women may reveal that they haven't seen the dentist in a long time, don't have one to go to, or didn't think they should when pregnant. In this case, reassure them that the dental care is safe and important during the pregnancy, and offer assistance to find a dentist who will see pregnant women. Listen to your client when they talk to you about negative experience in the past or have fear and anxiety about getting dental care. Be empathetic and offer to help them find a dentist they can trust. Now let's talk about good oral health for infants. Dental decay is shared from the mom to the baby. Bacteria that contributes to decay can pass from the mother's mouth to the infant's mouth, causing cavities in baby's teeth. Practicing good oral health habits can prevent or reduce tooth decay and caries before the first tooth appears. Baby's teeth are hiding right beneath the gums. Baby teeth are important to the health of the adult teeth, and they can still get cavities. Milk, breast milk, formula, juices, and soda all have sugar in them that can cause cavities. Here are some points about infant care. Baby's gums are wiped with a soft, clean cloth after each feeding. Babies are not put down to rest with a bottle. Babies' emerging teeth are brushed twice a day with a smear of fluoride toothpaste. When baby's ready for solid foods, choose foods with no sugar added. When baby has two teeth that touch each other, begin flossing daily. And be sure to bring your baby to the dentist after the first tooth appears and no later than the first birthday. Now let's watch this video.
Since you're watching this right now, chances are very good that you're about to have a baby. Congratulations! So am I. That's why I've got this great big smile on my face and why I'm doing everything I can to keep that smile healthy. I've learned taking care of my teeth and gums is especially important right now. As you'll see, our dental health has a lot to do with our baby's future dental health. Like the rest of our bodies, our mouths are going through a lot of changes. Have you noticed that your gums are sore now and bleed easily? I have. I asked my dentist and she says,
this happens to many women. It's called pregnancy gingivitis, and it can appear as early as the first 3 months of pregnancy. An increase in hormones can exaggerate the way the gums react to plaque buildup. It's the plaque, not your hormone levels, that can lead to gum disease. Getting treatment now will make a difference in your health and the future health of your baby.
So my dentist told me to brush twice a day with fluoride toothpaste. I know, you've heard this before. And floss every day. And especially now, don't be a stranger to your dentist.
If your last dental visit was more than 6 months ago, schedule an appointment soon. Tell the dental office you're pregnant and your due date. This will help them provide the best care for you. Oral health care, including the use of x-rays, pain medication, and local anesthesia, is safe throughout pregnancy.
What and how I eat is really important for us both right now. It's all about a healthy diet. When I need a snack, I try to choose foods that are nutritious for me and my baby.
Your baby's teeth begin to develop between the 3rd and 6th months of pregnancy. To help the teeth form correctly, they need enough vitamins, minerals, and other nutrients.
I do my best to eat a variety of fruits, veggies, and dairy products, all the good stuff, while staying away from the foods that are high in sugar. It's hard, but I know it's for a very good cause. And before you know it, there's a big change in your life. But it's still important to keep your mouth healthy as well as your baby's.
Begin cleaning your baby's mouth during the first few days by wiping the gums with a clean, damp piece of gauze or washcloth. It's important to remove as much bacteria as possible.
Did you know bacteria causes tooth decay? My baby can actually catch bacteria from me, so I've got to keep my mouth healthy. My dentist told me not to share spoons or cups with my baby and not to lick her pacifier to clean it. Even though baby teeth will eventually fall out, it's important to take good care of them.
Baby teeth hold space in your child's jaw for adult teeth. If a baby tooth is lost due to decay, permanent teeth can drift into the empty space and make it difficult for other teeth to come in. Decay can start as soon as those first teeth appear, especially when a baby's teeth are in contact for long periods of time with sugary liquids, like fruit juice, sweetened water, formula, and even breast milk. It's called baby bottle tooth decay.
So I never put my baby to bed with a bottle or sippy cup, or use a bottle as a pacifier when she's fussy. Okay, now when can we expect to see those first baby teeth?
Your baby's first teeth will begin to appear as early as 4 to 6 months. The front 2 upper and 2 lower teeth usually appear first. Most children have a full set of 20 baby teeth by the time they are 3 years old. The adult teeth start to appear at about age 6.
But when teething begins and my baby's gums are tender or sore, what can I do?
Gently rub your child's gums with a clean finger, a cool teething ring, or a wet gauze pad. But avoid gels or creams with benzocaine before the age of 2. These products are meant for adults and shouldn't be given to babies without talking to your dentist or pediatrician.
And once those teeth start coming in, what's good for me is also good for her. My dentist told me to brush her teeth gently twice a day with a child-sized toothbrush and water.
And be sure to schedule your baby's first trip to the dentist by at least that first birthday. Don't wait for your child to start school or until there's a dental emergency to get used to visiting the dentist. When your child's a bit older, we'll talk about flossing and starting to brush with just a small amount of fluoride toothpaste. Hi, nice to see you both. Getting into a routine early will put your baby on the right path to a healthy smile from the start.
Here are a few more commonly asked questions. What can I do to take care of my baby's mouth before their teeth break through? Whether you breastfeed or bottle feed, wipe your baby's gum after each feeding and before bedtime. Also, keep taking care of your own oral health and avoid cleaning pacifiers with your mouth. Bacteria that contributes to decay can pass from the mother's mouth to the infant's mouth. Here's another question. What do I do if my baby falls asleep with a bottle while feeding? Wipe their gums to help wipe away sugar and bacteria. Avoid putting baby down with a bottle. And lastly, are baby teeth important? Yes, it is important to keep baby's teeth cavity-free even though they will eventually fall out. Now, let me tell you a little bit about toddlers and children. Untreated dental disease can cause premature tooth loss, which can affect adult teeth, problems with eating, malnourishment, and speech, and also with self-esteem and confidence. Oral health problems and school problems. An estimated 51 million school hours are lost per year due to dental-related illnesses. Young children may not be able to tell you about their symptoms, which can be missed by adults by risking untreated oral health problems. They might instead be seen by grabbing, punching, pulling at their jaw or mouth, or crying when eating. According to the Center for Disease Control and Prevention, dental caries remain the most common chronic disease of children aged 6 to 11 years and adolescents 12 to 19 years. Tooth decay is 5 times more common than asthma among adolescents aged 14 to 17 years. Dental caries also affect adults. There are 3 main actions you can take to have good oral health. Daily care routine. Brush teeth twice a day. don't go to bed without brushing your teeth. And brush properly. Use a soft toothbrush, moving gentle circular motions to remove plaque, and take your time, 2 minutes brushing. Limit sugary drinks and snacks, anything sweet that sticks to your teeth. Tap water is a good choice because it's fluoridated. Routine dental care at the dentist. First appointment with the dentist when the first tooth erupts or by age 1. The first dental appointment is an exam and fluoride varnish, but more importantly, education on home care and diet to the caregiver or parent, and it sets the stage with the dentist for ongoing prevention. Children should be going to the dentist twice annually thereafter. Your child's pediatrician can apply fluoride varnish at the well-child visit. Fluoride is a mineral that strengthens the enamel of the tooth by helping with prevention of dental caries. Now let's watch another video.
Tooth decay is the most common disease children experience. You can help prevent your child from developing tooth decay by brushing his teeth twice a day. Included in this video are practice tips on toothbrushing, including selecting toothbrushes, using the right kind and amount of toothpaste, toothbrushing technique, tips for brushing. Start brushing your child's teeth as soon as the first one appears in the mouth. Teeth are the weakest when they first come in, so getting small amounts of fluoride on the teeth early and often is important to make the teeth stronger and more resistant to tooth decay. Use a special kid's toothbrush when you brush. Kids' brushes fit little mouths and have soft bristles. Use the toothpaste that contains fluoride, as it is the fluoride that strengthens the teeth. Use the right amount of toothpaste. For children under age 3 years, use a smear of toothpaste about the size of a grain of rice. For children ages 3 to 6 years, use a pea-sized amount of toothpaste. Start with the teeth in the back of the mouth and work around to the front and then to the back teeth on the other side of the mouth. Be sure to get the front, back, and biting surfaces of each tooth. Use a gentle left to right scrubbing motion to brush 1 to 3 teeth at a time before moving on to the next group of teeth. Some parents express that it is difficult to brush their baby or toddler's teeth. Here are some options for you to try. You can brush your baby's teeth while he is on the changing table. He's in a great position for you to see his mouth, and the toothbrush and paste can be stored nearby. Sit on the floor and rest your child's head on your thigh. His head may tip back slightly, allowing you to see into his mouth. This can be done in any room, but it is probably most convenient near the area where you store the toothbrush and toothpaste. If your child resists having his teeth brushed, you may swing your leg over his body, allowing you to hold down his arms in order for you to get the job done. This is often the best approach for children who protest toothbrushing, as you will have the most control over his body while supporting his head. Longer term, you may be able to use this position without your leg. Another option is to place your child in front of your body so that her head is pressed against your chest. If she refuses to open her mouth, slide your finger inside her cheek until you reach a bony area at the back of the mouth. Push slightly to encourage her to open. For some children, wrapping them in a towel can work well. This way they feel safe and secure and their arms are tucked inside the towel. This works well after bath time. Regardless of which approaches work best for your child, set a goal of brushing your child's teeth twice a day with a small amount of fluoride toothpaste in order to prevent tooth decay. Children with tooth decay in their baby teeth are more likely to have dental problems in their adult teeth. In other words, baby teeth really do matter.
What is fluoride and why it is important for my children? Fluoride is one of the best and safest ways to prevent dental caries in children and adults. Fluoride protects the teeth by making them stronger and more resistant to acid, reducing the risk of caries. Both your dentist and pediatrician or family provider can apply fluoride varnish to your child's teeth. What do I teach my child about brushing? Be a role model. Brush twice a day, morning and before bed, for 2 minutes. Some parents will set a timer or play a 2-minute song during TV commercial breaks, or turn it into a brushing game. Here are some more questions. When should my child see the dentist? A checkup every 6 months is recommended in order to prevent caries or other dental problems. Is mouthwash safe? Yes. It is safe and effective and is recommended to use brands with low or no alcohol content. Use mouthwash before brushing. Move it around your entire mouth before spitting it out. Let's talk about our ABC program. In our ABC program, we recommend parents to ask for fluoride varnish at the well-child visit. The dental varnish is made of fluoride, a mineral that can strengthen the tooth enamel. Parents can ask for fluoride varnish at the well-child visit. It is safe and used by healthcare providers all over the world to help prevent tooth decay in children. Be sure to ask your dentist about getting fluoride varnish for your child. Now, let me tell you a little bit about the Connecticut Dental Health Partnership, the dental plan for Husky Health. The Connecticut Dental Health Partnership is the dental plan for Husky Health and is administered by Bennecare Dental Plans under a contract with the Connecticut Department of Social Services. A lot of people don't realize that Husky Health members have a dental plan. Here's what the card looks like. Our number is on the back. Our mission: enable Husky Health members to achieve and maintain good oral health through member services and referral and care coordination, respectful and culturally sensitive communication, focusing on prevention, making it easier for dentists and community partners, and collaboration with community agencies and dental providers. In order for the Connecticut Dental Health Partnership to fulfill its mission of enabling all Husky Health members to achieve and maintain good oral health, we have to think about oral health equity. And the ability and access for oral health services are fairly distributed across the Medicaid population. We are achieving this in several ways. We want to ensure our programs, skills of our employees, and our members' communication meets the national standards for culturally and linguistically appropriate services in healthcare. Our efforts include ensuring our website is readable for those who speak a language other than English. Our call center uses language-assisted tools for members who are deaf or hard of hearing. We're working to develop partnership with health systems and medical providers to integrate oral health into overall health programs. This includes helping cancer patients to get dental clearance before starting cancer treatments and assisting diabetic patients in reducing the risk for gum disease. And lastly, we are using data to help guide our work. We are proud of our performance. Connecticut is the second highest rate of preventative dental services for Husky Health members aged 1 to 20. We are one of only 21 states with extensive Medicaid adult dental coverage. And we have over 1,500 dentists to meet the needs of Husky Health members. At our member service call center, you can talk to a live representative, find a dentist, get referrals for dental providers. They can help you scheduling an appointment, translation services, and also to obtain transportation for Husky A, C, and D. You can also get answers to questions about your benefits. Our number is 1-855-CT-DENTAL, and we're open Monday to Fridays from 8 to 5. Here's a quick overview of our dental benefits. Oral exams, cleanings twice a year for under 21 and once a year for 21 and older. Sealants, x-rays, fillings, extractions, partial and full dentures, root canals, crowns, oral surgery, and orthodontic services are the straightening of the teeth for significant dental reasons. For under 21 only with a prior authorization. The Connecticut Dental Partnership has a care coordination and outreach team that includes 9 dental care specialists, 6 cover different regions of the state, 1 is focusing on rural outreach, and 2 dental healthcare specialists support members with special healthcare needs. This part of our presentation explains how, what, and when is best to work with our team here at the Connecticut Dental Health Partnership. We want you to make referrals. Who? Any Husky Health member who needs assistance finding a dentist and obtaining a dental appointment, including transportation support and language assistance. When should you refer a client? When you see anyone with the presence of oral health condition, diagnosis, or documented or reported by a physician or a dentist, or someone who's working under a physician order and does not have a regular dentist. Or when clients say their children don't have regular dental checkups and they don't have a regular dentist by age 1. Or when pregnant women respond no when asked if they get regular dental checkups. Now, let's talk about how you can refer your clients. Referring your clients is easy. First, if your client needs to find a dentist who's on Husky or needs to make an appointment, they can call our Member Services Center at 855-CT Dental. If your client requires more assistance or has special needs, they can be referred to our care coordination team. To do that, if you haven't registered as a community partner yet, it is easy to register. Simply go to ctdhp.org, click on Community Partners, and then Why Partner with Us. Scroll down to the bottom of the screen to the Action Center. There you will find everything you need to register as a community partner if you haven't already. You can refer a client to the care coordination team, and you can even order oral health resources for your agency. Let me show you. So while you're at ctdhp.org, go to Community Partners, and then Why Partner with Us. At the bottom of the page, you will find Action Center. You can become a community partner, refer a client for assistance with complex needs, and order CTDHP materials. To become a community partner, you will need your name, last name, organization name, address, city, state, zip code, phone number, and your role in your organization. After you become a community partner, you can refer a client for care coordination services. Click on Referral Portal. Then you will have to sign in with your email address and password. Then on the left of the screen, you will find Member Referral to CTDHP Care Coordination. Click there, and then you have the form to refer a client. Click Member being referred to CTDHP is a Husky Health member, and also click Member has been made aware of this referral to CTDHP. Your contact information below. Then if you would like to be contacted by CTDHP dental care specialist, click yes or no, following by client's information, date of birth, and address. And then at the bottom of the page, if the client is not 18 years of age, you will need to include the responsible party's information. Scrolling down, you will find a section about members' oral health needs. You will need to include any information that will be helpful for this referral. Also, if the client has any other barriers to access care, please include in this section. If you have any documents that you will need to include with this referral, click yes and then continue. You will find a section where you can attach any documents and then submit the referral. That's all we have for you today. We hope you have learned about how to identify and suggest good oral health habits for pregnant women, moms, infants, and children. We also hope you have learned more about the Connecticut Dental Health Partnership and how you can refer your clients who are Husky Health members to the Connecticut Dental Health Partnership call center and care coordination teams. Thank you.